In 2017, there were about 2,000 opioid-related overdose deaths in the Commonwealth. In an attempt to curb drug use in the state, the Massachusetts Legislature recently passed an act for prevention and access to appropriate care and treatment of addiction, also known as the Opioid Bill. Elizabeth Kalajian sat down with State Representative Denise Garlick to find out what this means for residents.
Thank you so much for being here today. We really are interested to know and learn about this new opioid bill. Could you tell me why it's important and what's in the bill?
Absolutely. So why it's important, the people of Needham know full well. For all the individuals and families and for our community, we are dealing with a public health crisis of addiction, and we are dealing with an opioid epidemic. What is involved in the bill in our ability to address this is three parts. There is the part that concerns prevention, and the important part about prevention in this bill is that we have been involved in this crisis since 2010, and each year we begin to make steps forward, but we have devoted our energy and our resources to care and treatment. That's very appropriate, and we continue that. But in this bill that my committee wrote, we turn a major focus to prevention, because we are going to conquer this disease of addiction. We are going to stop this public health crisis with every resource and the expertise that we have. The way we can do that is by first and foremost developing a commission that strengthens our community work. In the Commonwealth of Massachusetts for substance use disorder, we have put considerable resources into our schools and followed that with money. And we do a lot of substance use disorder prevention training in our schools. But in our community, we have great resources in the groups that are working. Our hospital is working on the use of substance use disorder, the YMCA, the Visiting Nurses Association, certainly our town through the youth services and through the Council on Aging. And we want to make sure that all of these entities not only work together in synergy, but they have the resources they need and the best information possible on best practices. And so the commission with a trust fund is going to be able to provide that information to our community. We need to take this fight right to the community level and work together. There is a section of this bill that deals with building capacity. Many people have a loved one, someone they care about deeply, who when they're ready to access care and treatment can't find the bed they need, can't find the community resource that they need. This bill deals with that issue. The bill deals with the immediate care and treatment. One of the things that's important for every citizen in Needham to know that this bill writes a prescription for every citizen in this Commonwealth to be able to get Narcan at the pharmacy. Anyone can go. You can go to our local pharmacy, ask for Narcan, pay for it either with your insurance or pay privately for that, and carry that Narcan with you. That's vitally important. It makes every citizen of the Commonwealth a lifesaver.
When does this bill go into effect? And also after that, can we touch upon why it specifically affects Needham?
As you can imagine, with a situation like this, the bill has an emergency preamble and will go into effect immediately upon the governor's signature. The bill was passed last week. It will be signed within the next 10 days. It affects Needham because Needham's one of 351 towns in the Commonwealth that is struggling with this issue. There is no town that is exempt. There is no socioeconomic barrier. The entire Commonwealth is dealing with an opioid epidemic, is dealing with the public health crisis of addiction. More than 2,000 people died of an overdose just in the year 2017. This issue affects everyone. And if we sat at our kitchen table or if we went to a local meeting or a restaurant and people felt like they could talk about this issue, many people feel like they can't talk about it. But if they talked about it, everybody's got a story, somebody that they're concerned about. So in Needham, when we talk about prevention, we're doing good prevention work in Needham. We can strengthen that. When we talk about building a behavioral health system, we have good resources in Needham. We need more, and we need to be sure that people can get the resources when they need them. whether it's inpatient beds, whether it's a robust community support system. We need to build that so the people in Needham can get care and treatment in our own hometown.